The emergency room at St. Jude's Memorial was Dr. Justin Sterling's absolute kingdom. He was a brilliant trauma surgeon, but his ego was legendary. He was known to fire nurses mid-shift simply for handing him the wrong gauge needle. So, when a quiet, unassuming temp nurse named Evelyn Gallagher walked into the ER on a chaotic Friday night, no one expected her to survive his wrath for more than an hour. They certainly didn't expect that by midnight, the terrifying Dr. Sterling would be standing frozen in Trauma Bay 1, staring in stunned, humiliated silence as Evelyn seized total control of his room, barking out life-saving orders with the cold, hard authority of a battlefield commander. St. Jude's Memorial Hospital in downtown Chicago was a Level 1 trauma center that thrived on controlled chaos. But under the Friday night fluorescent lights, the chaos was entirely dictated by one man, Dr. Justin Sterling. Sterling was a tall, sharply featured attending physician who wore his brilliant surgical record like a loaded weapon. He didn't just walk through the ER, he parted it. Nurses flattened themselves against the walls when he strode past. Residents trembled when he demanded a patient's history, terrified of stuttering or omitting a microscopic detail. To Sterling, the support staff weren't colleagues. They were merely hands meant to serve his brain. At 7 p.m., the automatic doors hissed open, and Evelyn Gallagher walked in. She didn't look like much. 34 years old, wearing standard-issue navy blue scrubs that looked a size too big. Evelyn had her sandy blonde hair pulled back into a tight, utilitarian bun. She wore no makeup, no jewelry save for a plain black digital watch, and her expression was entirely unreadable. She had been sent by a high-end travel nursing agency to cover a desperate staffing shortage that St. Jude's had been battling for months. Brenda Higgins, the veteran charge nurse, who had survived 3 decades in the ER by knowing exactly when to speak and when to hide, met Evelyn at the main desk. Brenda handed over a clipboard with a tired sigh. "Listen to me carefully, Gallagher," Brenda said, her voice a low murmur as she glanced over her shoulder. "You're floating tonight. That means you fill in the gaps, do the IVs, push the meds, chart the vitals. But whatever you do, do not cross Dr. Sterling. He fired a girl named Chloe last week because she asked him to repeat a dosage order. He's got a god complex the size of Manhattan. You nod, you hand him what he asks for, and you stay out of his blast radius. Understood?" Evelyn took the clipboard. Her eyes, a striking, pale shade of gray, briefly scanned the chaotic floor. "Understood, Brenda. Hand him what he needs. Stay out of the blast radius." Her voice was calm, unnervingly calm. It didn't have the slight tremor of a new temp, nor the forced cheerfulness of someone trying to make a good first impression. For the first 3 hours, Evelyn was practically a ghost. But Brenda, watching from the central station, noticed something strange. Evelyn didn't just move through the ER. She navigated it with an eerie, predatory efficiency. She never took a wasted step. When she started an IV on a dehydrated, thrashing drunk, she didn't flinch. She simply pinned the man's arm with a grip that looked entirely disproportionate to her slender frame, found the vein by touch alone, and had the line secured in under 10 seconds. At 10:15 p.m., Dr. Sterling made his first direct contact with her. A young resident, Dr. Toby Miller, was sweating profusely as he tried to examine a patient who had fallen off a ladder. The man was complaining of shoulder pain, and Sterling was standing over Toby, grilling him relentlessly. "Are you blind, Dr. Miller?" Sterling barked, his voice carrying across the ward. "Look at the clavicle. It's an obvious fracture. Wrap him, prep him for ortho, and stop wasting my time with your indecision." Sterling turned sharply to leave, nearly colliding with Evelyn, who was quietly taking the patient's blood pressure. "Move, nurse," Sterling snapped. Evelyn stepped aside, her face blank. But as Sterling began to walk away, she reached out and gently tilted the patient's head to the side. "Dr. Sterling," she said. Her voice wasn't loud, but it cut through the ambient noise of the ER perfectly. Sterling stopped in his tracks. He turned slowly, his eyes narrowing. "Excuse me? Did you just summon me?" "Take a look behind his left ear," Evelyn said, not meeting Sterling's gaze, but continuing to hold the patient's head. "Bruising, battle sign, and clear fluid is leaking from his left nostril. He doesn't just have a broken clavicle. He has a basilar skull fracture. If you send him up to ortho without a CT scan, he'll likely seize and stroke out in the elevator." The air around Trauma Bay 3 seemed to freeze. Toby Miller went pale, staring at Evelyn as if she had just pulled the pin on a grenade and handed it to the attending. Sterling marched back to the bed, roughly shoving Toby aside. He grabbed a penlight and flashed it behind the patient's ear, then looked at the man's nose. The dark purple bruising was subtle, easily missed under the harsh lighting, but it was undeniably there. Sterling's jaw clenched. A muscle ticked in his cheek. He had missed it. The great Dr. Sterling had missed a life-threatening head injury because he was too busy berating a resident over a shoulder bone. He looked up at Evelyn, ready to tear her apart for the public humiliation. He expected to see a smug smile, or perhaps fear. Instead, he saw absolutely nothing. Evelyn had already let go of the patient and was efficiently documenting the finding on the chart. "Dr. Miller," Sterling said, his voice dangerously low. "Order a stat CT of the head, now." He glared at Evelyn. "What is your name?" "Gallagher," she said without looking up from her charting. "Evelyn, listen to me very closely, Gallagher," Sterling hissed, leaning in so only she could hear. "You do not diagnose in my ER. You do not correct me in front of my residents. If you ever speak out of turn again, I will have your agency contract terminated before your shift ends. Do we have an understanding?" Evelyn finally looked up. Her pale gray eyes locked onto Sterling's furious gaze. There was a depth in her eyes that made Sterling unexpectedly uncomfortable. A cold, dark well of something he couldn't quite place. "I understand completely, Doctor," Evelyn said softly. Sterling turned on his heel and stormed away. Brenda hurried over to Evelyn, looking terrified. "Are you insane? I told you to stay under the radar." Evelyn calmly capped her pen and slid it into her breast pocket. "A man's brain was swelling, Brenda. The radar wasn't an option." At 11:42 p.m., the red trauma phone at the central desk rang. In an ER, a regular phone ringing is background noise. The red phone ringing stops hearts. Brenda snatched the receiver. The color rapidly drained from her face as she listened. She hung up and slammed her hand down on the public address button. "Attention all personnel. Code triage. Level 1. We have a mass casualty incident inbound. I repeat, mass casualty inbound. Clear all trauma bays. All available staff to the ER immediately." The doors burst open, and Sterling strode out of the break room, a fresh cup of coffee in his hand, looking thrilled. This was his element. This was where he proved he was a god among men. "Report," Sterling barked. "Multi-vehicle pileup on the icy overpass of I-90. Brenda rattled off rapidly, her hands flying over her keyboard to reroute non-critical patients. A semi-truck jackknifed into a charter bus. Several cars wedged underneath. Paramedics report at least 12 critical, multiple DOAs on scene. First wave is 2 minutes out. "All right, listen up," Sterling yelled, clapping his hands together. The entire ER staff froze, turning to him. "This is my house. We do things my way. Nobody touches a patient without my clearance. Nobody pushes a med without my verbal order. Dr. Miller, you take Bay 2. Dr. Chen, Bay 3. I will take Bay 1 and run point. We are going to be drowning in blood in exactly 90 seconds, so I suggest you all find your spines right now." Evelyn stood quietly near the crash cart by Trauma Bay 1. She was methodically checking the seals on the chest tubes, drawing up pre-measured doses of epinephrine, and hanging bags of O-negative blood on the rapid infusers. She hadn't been told to do any of this. She just knew it would be needed. The wail of sirens pierced the cold Chicago night, growing deafeningly loud until the ambulance bay doors flew open in a flurry of flashing red and blue lights. Paramedic Jackson Reynolds burst through the doors, pushing a gurney that was covered in blood. Behind him, 3 more stretchers were rolling in, creating an instant bottleneck of screaming, chaos, and metallic smells. "Bay 1, Sterling ordered, waving Jackson toward him. Jackson shoved the gurney into the center of the room. The patient was a man in his 50s, wearing the shredded remnants of a bus driver's uniform. His lower body was a mangled mess. "Arthur Pendleton, 52, Jackson yelled over the din of the room. "Driver of the bus, pinned under the steering column for 20 minutes. Crush injury to the pelvis and lower extremities. Heart rate is 140. BP is tanking at 70/40. We pushed 2 liters of saline on the ride. He's barely holding on. All right, on my count. Transfer, Sterling yelled. 1, 2, 3. They hoisted Arthur onto the trauma bed. The man was moaning, his face ashen, his chest heaving irregularly. Sterling immediately stepped up, his eyes fixated on the man's severely distended abdomen and shattered pelvis. "He's bleeding out internally. Massive pelvic trauma. Miller, get over here," Sterling yelled, pulling the resident away from another patient. "I need an ultrasound of his abdomen. Now. Brenda, push another liter of crystalloids. We need to get him up to the OR for an exploratory laparotomy. He's got a shredded spleen or liver." Evelyn stood at the head of the bed. She placed her fingers on Arthur's carotid artery. It was weak, thready, and racing like a hummingbird. But as she looked down at his chest, her eyes narrowed. The right side of his chest was expanding, but the left side wasn't moving at all. "Doctor," Evelyn said, her voice cutting through the noise. "Look at his neck. His jugular veins are distended." Sterling didn't even look up. He was furiously scrubbing Arthur's stomach with iodine. "He's in hemorrhagic shock, Gallagher. Of course, his vasculature is reacting. Focus on getting me a scalpel. We might need to open his abdomen right here, if his pressure drops any further." Evelyn leaned down, pressing her ear directly to Arthur's chest, ignoring the sterile field. No breath sounds on the left. The trachea was visibly deviating to the right. Arthur gasped, a horrific, choking sound, and the monitor began to scream. His oxygen saturation plummeted to 70%. Heart rate spiked to 160. "He's crashing!" Toby Miller panicked, the ultrasound wand shaking in his hand. "Pressure is 50/palp. Scalpel. Now!" Sterling screamed, holding his hand out. "I'm doing an X-lap. He's bleeding out in his belly." It was the wrong call. It was a fatal call. If Sterling cut open the abdomen of a man who couldn't breathe, the sudden drop in pressure would send him into immediate cardiac arrest. The patient had seconds left. Evelyn didn't pass the scalpel. Instead, a profound, terrifying shift occurred. The quiet, unassuming temp nurse vanished. Her posture straightened, her shoulders squared, and when she spoke, her voice didn't just cut through the room, it shattered the air like a gunshot. It was a voice forged in the dust and blood of forward operating bases in Kandahar, a voice that had commanded life and death under mortar fire. "No." The single word echoed off the tiled walls. Sterling froze, his hand still outstretched. He looked up, his face contorting with absolute, unadulterated rage. "What did you just say to me?" Evelyn didn't look at him. She was already moving. "He does not have a shredded liver. He has a tension pneumothorax," Evelyn barked, pointing violently at the man's chest. "His left lung has popped. Air is filling the chest cavity, and it's crushing his heart. If you cut his belly open right now, he will code and die on this table in 10 seconds. You dare!" Sterling began to roar, stepping toward her. "Shut up and step back," Evelyn roared back, her voice so incredibly dominant that Dr. Justin Sterling, the terror of street Judes, actually took a physical step backward. The entire trauma bay fell dead silent. Toby dropped the ultrasound wand. Paramedics stopped in the doorway. Even the screaming from the hallway seemed to mute. No one had ever, in the history of the hospital spoken to Dr. Sterling that way. Evelyn didn't waste a millisecond basking in the shock. She took total command. "Miller," Evelyn snapped, locking eyes with the terrified resident. "Grab a 1-4 gauge needle. Find the second intercostal space, mid-clavicular line on the left side. Plunge it in. Do it now, or you are watching this man die." Toby was frozen, looking between the furious Sterling and the terrifying nurse. "Now, Miller," Evelyn bellowed. Toby flinched, grabbed the massive needle from the tray, found the spot on the man's chest, and drove it in. A loud, distinct hiss filled the room as trapped, pressurized air violently escaped the patient's chest cavity. Instantly, Arthur Pendleton took a massive, shuddering gasp of air. The alarm on the monitor shifted its tempo. His oxygen saturation rapidly climbed from 70% to 92%. His heart rate dropped back to 110. He was stabilizing. Evelyn didn't stop. She turned her blazing eyes onto Brenda. "Brenda, cancel the saline. Saline doesn't carry oxygen. Get 2 units of O-negative whole blood on the rapid infuser right now. And get me a bedsheet." A bedsheet?" Brenda stammered. "He has an open book pelvic fracture," Evelyn ordered rapidly, her hands already flying over the patient's lower body. "His pelvis is split open like a hinge, and he's bleeding into the empty space. If we wrap a sheet tightly around his hips and tie it off, we close the book, reduce the volume of the cavity, and tamponade the bleeding. Move." Brenda ran, grabbing a sheet from the linen cart. Together, with a synchronized, brutal efficiency, Evelyn and Brenda wrapped the sheet around Arthur's shattered hips, crossing it and pulling it excruciatingly tight, tying it into a knot. Evelyn looked at the monitor. Blood pressure was climbing. 80/50, 90/60. The immediate crisis was averted. The patient was alive, breathing, and stabilized enough to make it to the operating room. Evelyn finally stopped moving. Her chest was heaving slightly. She slowly turned her head and looked directly at Dr. Justin Sterling. Sterling was still standing in the exact spot he had retreated to. His hand was still half raised, demanding a scalpel that was never given. His mouth was slightly open. His eyes were wide, darting from the stabilized patient on the bed to the plain-looking temp nurse standing across from him. He was entirely, unequivocally, silent. The great Dr. Sterling had been stripped of his command in under 30 seconds, and every single person in the room had watched it happen. Evelyn held his gaze, her gray eyes hard as flint. "The patient is stabilized, doctor," Evelyn said, her voice dropping back to that unnervingly calm, quiet tone. "Would you like to proceed with your exploratory laparotomy now?" For 5 agonizing seconds, the only sounds in Trauma Bay 1 were the rhythmic, artificial hiss of the ventilator and the steady, stabilized beep, beep, beep of Arthur Pendleton's heart monitor. Dr. Justin Sterling stared at the monitor, then at Evelyn. The color rushed into his face, a mottled, furious red that clashed violently with the harsh, fluorescent lights. His ego, an entity as massive and delicate as spun glass, had just been publicly shattered by a temp nurse in oversized scrubs. He wanted to scream. He wanted to have her escorted out of the building by security. But he couldn't. If he threw her out now, he would be the surgeon who prioritized his pride over a mass casualty event. More importantly, he would be the surgeon who almost cut open a man dying of a collapsed lung, a rookie mistake that Evelyn had just saved him from making. Sterling slowly lowered his hand. He swallowed hard, his throat dry. "Miller," he said, his voice completely devoid of its usual booming authority. "Get Mr. Pendleton to operating room 4. I'll meet you up there in 2 minutes." He didn't look at Evelyn again. He stripped off his bloody gloves, threw them aggressively into the biohazard bin, and pushed his way out of the trauma bay, the doors swinging wildly in his wake. The moment he was gone, the spell broke. Toby Miller let out a breath he seemed to have been holding for a minute. "Holy," he muttered, staring at Evelyn. "He's going to murder you. He's going to call the agency, then the nursing board, And then he's going to murder you. Evelyn barely registered the warning. She was already checking Arthur's IV lines, ensuring the whole blood was infusing properly. He can try, Dr. Miller, she said mildly. Now help me get this bed unlocked. We have 12 more patients bleeding in the hallway. For the next 3 hours, St. Jude's ER resembled a war zone. The influx of patients from the I-90 pileup was relentless. Fractures, lacerations, internal bleeding, and traumatic brain injuries flooded the bays. With Sterling upstairs in surgery, the ER lacked a definitive leader. Toby Miller, the senior resident, was smart but severely lacking in confidence. The other attending physician, Dr. Chen, was completely bogged down in Bay 3 with a complex spinal injury. Nature, and the emergency room, abhors a vacuum. Without asking for permission, Evelyn filled it. She didn't just float, she orchestrated. She moved through the bloody, screaming chaos with a terrifyingly calm precision. She implemented a rapid, brutal triage system that the civilian nurses had never seen before. She stood at the epicenter of the central desk and began issuing directives. Asterisk, green tags to the waiting room. I don't care if they're screaming. They can wait. Asterisk, yellow tags to the hallway beds. Start them on standard saline drips and get their vitals every 15 minutes. Asterisk, red tags into the bays. No one moves a red tag without a collar and a backboard. Brenda Higgins watched in awe as the temp nurse transformed the chaotic, panicking staff into a disciplined unit. Evelyn didn't yell, but her voice carried a distinct, commanding resonance that compelled instant obedience. When Toby Miller froze up while trying to place a central line in a violently shivering woman, Evelyn stepped up behind him. "You're shaking, doctor," she said quietly, her hands hovering over his. "Breathe out. Find your anatomical landmarks. Clavicle, sternocleidomastoid muscle. The vein is right there. Trust your hands, not your anxiety." Guided by her steady voice, Toby found the vein perfectly. He looked up at her, utterly bewildered by the sudden mentorship. "Where did you learn how to do that?" he asked. Evelyn just gave him a tight, perfunctory smile and moved to the next bed. At 2:15 a.m., the final ambulance from the crash site arrived. The doors blew open, and Brenda called out for Evelyn. "Gallagher, supply closet, right now." Evelyn finished wrapping a compression bandage on a patient's arm and stepped into the cramped supply closet. Brenda shut the door behind them, blocking out the noise of the ER. "All right, the gig is up," Brenda said, crossing her arms. "I've been an ER nurse for 32 years. I've worked with the best trauma specialists in the Midwest. You are not a regular travel nurse, floating between hospitals to pay off a mortgage. You run this room like a commander." "Who the hell are you?" Evelyn sighed, leaning against a rack of sterile saline bags. She reached into her pocket and pulled out her ID badge. She flipped it over. Taped to the back was a small, faded military challenge coin. "I spent 10 years in the United States Army Nurse Corps," Evelyn said softly, the adrenaline slowly leaving her voice. 5 of those years were spent at Forward Operating Base Salerno in Afghanistan, working with a Joint Special Operations Command surgical team. My commanding officer was Colonel William Hastings. We didn't have MRI machines or specialized trauma bays. We operated in tents while mortars shook the ground. We learned to diagnose internal bleeding by the smell of the room and the color of the patient's skin. Brenda stared at her, her eyes wide. "FOB Salerno, Rocket City. You were a combat trauma nurse." "Captain Gallagher," Evelyn corrected gently. "I was honorably discharged 8 months ago. St. Jude's is my first civilian gig. I'm trying to figure out how to work in a place where the lights stay on and the walls don't shake. But blood is blood, Brenda. And a tension pneumothorax looks the same in Chicago as it does in Kandahar." Brenda let out a low whistle. "Sterling is going to lose his mind when he finds out he tried to ego trip a decorated combat veteran." "Let him," Evelyn said, checking her watch. "The shift isn't over yet." At 3:30 a.m., The adrenaline that had kept the ER afloat began to curdle into deep, sickening exhaustion. Dr. Sterling returned from the OR. He looked pale, his surgical cap stained with sweat. He had managed to save Arthur Pendleton, but the procedure had been grueling. When Sterling walked back into the ER, he immediately noticed the shift in the atmosphere. The chaos had been wrangled into a stark, highly efficient order. The floors were being mopped, patients were stabilized, and at the center of it all, charting quietly at the main desk, was Evelyn Gallagher. The nurses weren't looking at Sterling with their usual mix of fear and reverence. They were looking past him, checking with Evelyn for their next tasks. The kingdom had been quietly conquered while the king was away. Sterling marched up to the desk, his jaw set. Gallagher. Evelyn looked up. "Doctor, how is Mr. Pendleton?" "Alive." "No thanks to your insubordination," Sterling lied through his teeth, desperate to reclaim his territory. "You got lucky with a guess. Don't think for a second that makes you my equal. You are a temporary employee, and when the administration opens at 8 a.m., I am having you removed from this hospital." Evelyn didn't blink. "Understood, doctor." Before Sterling could launch into another tirade, the red trauma phone rang again. Brenda answered it, her face instantly dropping. "Sterling, we have a late extraction from the pileup. It's a first responder. Firefighter David Wyatt, 28 years old. He was caught in a secondary collision while using the jaws of life. He has a massive piece of rebar impaled through his lower jaw and neck. ETA is 1 minute. Sterling's bravado vanished. Neck impalements were nightmares. The anatomy was too complex, the bleeding too catastrophic, and the airway too compromised. "Get Bay 1 ready. Set up for an emergent cricothyrotomy and a massive transfusion protocol," Sterling shouted, his voice cracking slightly. The ambulance arrived with a deafening screech of tires. The paramedics burst in, covered in blood, pushing a stretcher, carrying a young man in heavy turnout gear. A jagged, rusted piece of steel rebar protruded from the bottom of David Wyatt's jaw, exiting near his collarbone. He was choking on his own blood, his eyes wide with primal terror. "He's losing his airway," a paramedic screamed. "We couldn't tube him in the rig. The rebar is blocking the vocal cords." They transferred David to the trauma bed. Sterling rushed to the head of the bed, grabbing a laryngoscope. He forced the metal blade into David's mouth, trying to see past the blood and the rusted steel to insert a breathing tube. "Suction. I need more suction," Sterling yelled, panic edging into his voice. "I can't see the cords. There's too much blood." David began to thrash, his oxygen levels plummeting to fatal numbers. 65%. 60%. "He's going into cardiac arrest, doctor. We need an airway now," Toby Miller yelled. Sterling's hands were shaking. The great Dr. Sterling, the arrogant king of the ER, was freezing. He pulled the laryngoscope out, staring at the bloody mess. If he couldn't put a tube down his throat, he had to cut a hole in his neck to insert one directly into the trachea, a surgical cricothyrotomy. But the rebar was obstructing the neck. The anatomy was completely distorted. I can't find the cricothyroid membrane," Sterling stammered, his eyes darting frantically. The steel shifted his trachea. "I don't want to hit the carotid artery." "Doctor, he's dying," Brenda screamed. Suddenly, a pair of gloved hands firmly gripped Sterling's forearms. Sterling looked up. Evelyn was standing right beside him. Her gray eyes were locked onto his, completely bypassing the panic. Anchoring him to the room, "Dr. Sterling," Evelyn said, her voice dropping into that terrifyingly calm, combat-hardened cadence. "Look at me." Sterling, trembling, looked at her. "You are going to cut his neck," Evelyn ordered, her voice a steady drumbeat. "You are going to ignore the rebar. You are going to take your non-dominant hand, and you are going to grip his larynx like a baseball. Do it." Driven by sheer instinct and her overpowering command, Sterling reached out and gripped David's bloody throat. "Good," Evelyn said, standing shoulder to shoulder with him. "Now, slide your finger down. Feel the thyroid cartilage. Feel the divot just below it. The rebar pushed it to the right. Do you feel it? Sterling pressed his thumb down. Yes. Yes. I feel the divot. Evelyn slapped a Hashanah Zero scalpel into his right hand. Make a vertical incision. 1 inch. Deep and hard. Do not hesitate. Sterling didn't think. He just obeyed. He slashed down with the scalpel. Blood welled up instantly. Now horizontal, Evelyn commanded, her own hands moving in perfectly synchronized harmony with his, handing him a bougie, a long, flexible blue plastic guide wire. Insert the tip of your finger into the hole. Feel the air. Sterling pressed his finger in. I'm in the trachea. Slide the bougie over your finger. Then slide the tube over the bougie. Evelyn rapid-fired the commands, guiding the equipment into his hands before he even asked for it. Sterling slit the tube in. Evelyn instantly attached the bag valve mask and squeezed. A collective gasp echoed through the room as David Wyatt's chest rose perfectly. The monitor chirped happily as his oxygen saturation rocketed from a lethal 55% back up to 94%. Sterling collapsed back against the counter, his chest heaving, his scrub top soaked in sweat. He stared at his shaking hands, then looked at Evelyn. She was calmly securing the tube with medical tape, her face impassive. She had just walked him through one of the most difficult, blind, surgical airways imaginable. And she had done it with the casual competence of someone making a cup of coffee. Before Sterling could speak, the doors to the ER swung open, and a man in a tailored suit and a white coat walked in. It was Dr. Thomas Harris, the chief of surgery, and the hospital's chief medical officer. He had been woken up by the mass casualty alert. Dr. Harris bypassed the chaos, walking straight toward Trauma Bay 1. He looked at the stabilized firefighter, then at the exhausted Dr. Sterling. Finally, his eyes landed on Evelyn. A broad, relieved smile broke across the chief medical officer's face. Major Gallagher, Dr. Harris said, extending his hand. I see you've decided to end your undercover observation a few hours early. Sterling whipped his head around, staring at the chief. Undercover? Observation? What are you talking about? Dr. Harris turned to Sterling, his smile fading into a look of stern corporate reality. Justin, the board and I have been deeply concerned about the turnover rate of nurses in your department, as well as several questionable mortality outcomes on your shifts. We needed an independent, highly qualified auditor to evaluate your performance without your knowledge. Harris gestured to Evelyn. Allow me to formally introduce Major Evelyn Gallagher. She was the head of trauma protocols for the U.S. Army Nurse Corps and the author of the Department of Defense's revised manual on battlefield crush injuries. We hired her consulting firm to audit Street Jude's. Sterling's mouth opened, but no sound came out. He looked at the woman he had threatened to fire, the woman he had demeaned and ordered around. Evelyn finished taping the tube and finally turned to face Dr. Sterling. The blank, obedient mask of the temp nurse was completely gone. In its place was the hardened, unyielding gaze of a military officer who had just found her target lacking. You have brilliant hands, Dr. Sterling, Evelyn said, her voice echoing in the quiet bay. But a surgeon who cannot listen to his team is just a liability waiting to kill someone. I'll have my full report on the administration's desk by 8 o'clock. She stripped off her bloody gloves, dropped them in the bin, and walked out of the trauma bay, leaving the great Dr. Sterling standing frozen in absolute, humiliating silence. At 8 a.m., the executive boardroom on the top floor of St. Jude's Memorial Hospital was a stark contrast to the blood-slicked floors of the emergency department. The room smelled of expensive coffee and lemon polish. The morning sun cut harshly through the floor-to-ceiling windows, casting long, unyielding shadows across the polished mahogany table. Dr. Justin Sterling pushed open the heavy oak doors, his face a mask of barely suppressed fury. He had managed to shower and change into a fresh suit, but the exhaustion of the night's mass casualty event hung heavily on his shoulders. He was running on pure, unadulterated adrenaline, and the burning desire to protect his crumbling kingdom. Waiting for him were Dr. Thomas Arris, the chief medical officer, Margaret Hayes, the formidable chairperson of the hospital board, and sitting quietly at the end of the table, Major Evelyn Gallagher. Evelyn had shed her oversized, blood-stained navy scrubs. She was now dressed in a tailored charcoal blazer and a crisp white blouse. Without the utilitarian bun, her sandy blonde hair fell in sharp, clean lines around her face. She sat with the immaculate, terrifying posture of a military officer who was completely comfortable in hostile territory. Resting on the table in front of her was a thick, black, leather-bound folder. "Justin," Dr. Arris said, gesturing to an empty leather chair. "Please, sit down." "I prefer to stand, Thomas," Sterling snapped, gripping the back of the chair so hard his knuckles turned white. He glared at Evelyn. "This is an absolute farce. A staged ambush. You planted a spy in my emergency room to undermine my authority during a mass casualty crisis? Do you have any idea how dangerous that was?" "What was dangerous, Doctor?" "Sterling." Evelyn's voice cut through the air. "Completely devoid of heat, but heavy with authority, was your decision to perform an exploratory laparotomy on a patient suffering from a tension pneumothorax. A mistake that would have stopped his heart in less than a minute." Sterling flushed, his jaw tight. "I saved that man's life in the OR. After I stopped you from killing him in the trauma bay," Evelyn countered smoothly. She didn't raise her voice. She didn't need to. She simply opened the black folder and slid a printed document across the table. "Arthur Pendleton. Chart review. Initial assessment missed entirely by the attending physician due to failure to complete a secondary survey. Time wasted berating a resident instead of assessing the patient's airway." Margaret Hayes adjusted her glasses, peering down at the document. "Dr. Sterling, we did not hire Major Gallagher's firm to ambush you. We hired her because over the last 18 months, St. Jude's ER has seen a 34% increase in staff turnover, and our legal department has settled 3 major malpractice claims stemming from communication breakdowns in your trauma bays. I am the best trauma surgeon in this city," Sterling fired back, slamming his hand on the back of the chair. "My save rate is unmatched. You cannot expect me to coddle a bunch of overly sensitive, incompetent float nurses when people are bleeding to death." Evelyn flipped to the next page of her report. "David Wyatt, 28 years old. Traumatic neck impalement. You panicked. You lost your situational awareness. You failed to secure an airway, and you froze with a scalpel in your hand, while the patient's oxygen saturation dropped to 55%. Sterling's mouth opened, but the words died in his throat. The memory of his trembling hands, the blood pooling in the firefighter's throat, and Evelyn gripping his wrists, flashed vividly in his mind. "I guided your hands, Doctor Sterling, because you possessed the mechanical skill to save him, but you lacked the psychological composure to lead the room," Evelyn continued, her pale gray eyes locking onto him. "You don't lead your team. You terrorize them. You demand blind obedience, which means when you are wrong, and statistically, every doctor is wrong eventually, no one feels empowered to stop you. Your ego is an active threat to patient mortality." Silence descended on the boardroom. The words hung in the air, absolute and damning. Dr. Arris sighed, rubbing his temples. "The numbers don't lie, Justin," Arris said quietly. "Your surgical technique is flawless, but your department is a toxic wasteland. You've created an environment where residents are too terrified to speak up, and nurses are too afraid to verify orders. That stops today." Sterling swallowed hard. The fight was rapidly draining out of him, replaced by a cold, sinking dread. "So, what? You're firing me? The board is terminating my contract?" "No," Margaret Hayes interjected, folding her hands on the table. "Replacing a surgeon of your caliber is difficult, and despite your catastrophic flaws in leadership, you did successfully repair Mr. Pendleton's pelvis last night. We are not terminating you. We are putting you on probation." Sterling blinked, stunned. "Probation? Effective immediately, you are stripped of your title as head of trauma, Eris stated, sliding a formal contract across the table. You will continue to operate, but you will no longer run the floor. Furthermore, the board has retained Major Gallagher's firm for a 6-month contract. They specialize in high-stress medical team integration and crisis leadership training. Eris leaned forward, looking Sterling dead in the eye. You are going to undergo a mandatory, rigorous, peer leadership retraining program, and Major Gallagher will be your direct evaluator. If you fail to pass her assessments, or if there is even one report of you berating a member of the support staff, your privileges at St. Jude's will be permanently revoked. Do we have an understanding? Dr. Justin Sterling, the undisputed king of the St. Jude's emergency room, looked at the contract, then looked at Evelyn Gallagher. She offered no smug smile, no victorious gleam in her eye. She looked at him the way a mechanic looks at a broken engine, a problem to be disassembled, cleaned, and rebuilt. For the first time in his professional life, Sterling was completely, utterly powerless. "I understand," he whispered. 3 weeks later, the atmosphere in the St. Jude's emergency room had fundamentally shifted. The suffocating blanket of fear that used to smother the ward the moment Dr. Justin Sterling walked through the automatic doors had lifted. Sterling was back in his scrubs, but the invisible crown was gone. Standing 5 feet behind him, holding a digital tablet and wearing her crisp charcoal blazer, was Major Evelyn Gallagher. She was his shadow. She observed his every move, every interaction, and every diagnosis. For the first 2 weeks, it had been sheer agony for him. Every time he felt the urge to snap at a nurse for moving too slowly, he would catch Evelyn's impassive, flinty gaze, and the cruel words would choke in his throat. He felt humiliated. He felt like a medical student again, constantly second-guessed and monitored. But as the days wore on, something strange began to happen. Deprived of his usual crutch of intimidation, Sterling was forced to actually communicate. At 4:15 p.m. on a rainy Thursday, the red trauma phone blared. Brenda Higgins answered it, her seasoned face tightening. "Listen up. Incoming. 10 minutes out. 19-year-old male. Industrial accident at the Southside Steel Plant. His right arm and shoulder were caught in a hydraulic press." Brenda rapidly listed the grim statistics. Asterisk injury. Catastrophic crush injury to the right upper extremity. Asterisk vitals. Hypotensive and tachycardic. Tourniquet. Intervention. Tourniquet applied high on the axilla by first responders. Sterling felt the familiar, icy spike of adrenaline. A crush injury of that magnitude meant massive tissue damage and hyperkalemia, a fatal spike in potassium leaking from crushed muscle cells. If he released the tourniquet without prepping the patient's system, the sudden rush of toxins would stop the boy's heart instantly. "Trauma Bay 2, Sterling announced, his voice tight but remarkably controlled. He didn't bark. He didn't demean. He simply delegated. "Dr. Miller, I want you on the left side, managing the primary survey and airway. Brenda, we're going to need a massive transfusion protocol ready. O negative. We also need calcium gluconate and insulin ready to push to counteract the potassium." Evelyn stood in the corner, her stylus tapping quietly against her tablet. The ambulance doors crashed open, and the paramedics rushed the stretcher in. The young man, Liam, was deathly pale, covered in industrial grease and blood. His right arm was a horrific, mangled mass of flattened tissue and splintered bone. "Transfer on 3, Sterling ordered. 1, 2, 3. Sterling stepped up to the mangled arm. The damage was devastating. The brachial artery was completely crushed. "Heart rate is 150. Pressure is 75/40, Toby Miller reported, his hands working quickly to secure a secondary IV line. Sterling's mind raced through the surgical steps. He needed to cut open the arm to relieve the pressure and find a vessel to graft. But the damage extended dangerously high into the shoulder joint. It was a chaotic, bloody puzzle. His hand hovered over the tourniquet. The old panic, the overwhelming urge to scream for a scalpel and just start cutting blindly flared up in his chest. He couldn't see the anatomy. He stopped. He didn't yell. He didn't throw a tantrum. He slowly pulled his hand back and looked across the trauma table at his resident. "Dr. Miller," Sterling said, his voice surprisingly steady. "The crush injury extends past the surgical neck of the humerus. If I release the pressure, the retroactive bleeding into the chest cavity might be uncontrollable before I can clamp the subclavian artery. What do you see?" Toby Miller froze. The terrifying Dr. Sterling was asking him, a resident, for a consult on a critical, split-second trauma decision. Toby looked at the mangled arm, then at the monitor, his mind working furiously. "Sir." Given the location of the crush, Toby stammered slightly, then found his footing. "If you try to clamp it from below, you'll be operating blind in a pool of blood. We should prep his chest, make an incision above the collarbone, and clamp the subclavian artery before you release the tourniquet. Cut off the water main before you fix the pipe." Sterling stared at Toby. It was a brilliant, highly advanced surgical strategy. Sterling looked at his charge nurse. "Brenda, do you agree? Can we afford the 2 minutes it takes to prep his chest? Or is his pressure dropping too fast?" Brenda, momentarily shocked that she was being consulted on a surgical timeline, checked the rapid infuser. "The blood is flowing, Dr. Sterling. His pressure is holding at 80/50. You have a 2-minute window. We can prep his chest right now." Sterling took a deep breath. The massive, suffocating weight of having to be the sole genius in the room vanished. He had a team, and they were highly capable. "Good call, Dr. Miller," Sterling said, a genuine note of respect in his voice. "Brenda, prep the right clavicle. Scalpel. Has Sean a 0 blade. Let's clamp that artery and save this kid's life." The room moved with a synchronized, beautiful efficiency. There was no shouting, no paralyzing fear. Just highly trained professionals working in unison. Sterling made the incision above the collarbone, isolated the artery, and clamped it tight. When he finally released the tourniquet on the mangled arm, there was no catastrophic hemorrhage. They had controlled the battlefield. 20 minutes later, Liam was stabilized and being wheeled up to the operating room for reconstructive surgery. Sterling stood at the sink, washing the blood from his hands. He felt a deep, profound exhaustion. But for the first time in years, it wasn't accompanied by a bitter, isolated anger. He grabbed a paper towel and turned around to find Evelyn standing in the doorway. She wasn't holding her tablet. "You didn't panic," Evelyn said quietly, crossing her arms. "You didn't yell. You encountered a tactical block, and you utilized the assets around you to find a flanking maneuver." Sterling leaned against the sink, offering a small, tired smile. "He's a smart kid, Dr. Miller. I never really noticed before." "You never let him speak long enough to notice," Evelyn replied softly. Sterling looked down at his shoes, then back up at her. The animosity that had burned so brightly between them 3 weeks ago had completely dissolved, replaced by a strange, hard-earned, mutual respect. "I hated you, you know," Sterling admitted, his voice rough. "When you embarrassed me in front of the entire ER, I wanted to destroy your career." Evelyn offered a microscopic, knowing smirk. "I've had Taliban warlords put bounties on my head, Dr. Sterling. A bruised surgeon's ego didn't exactly keep me up at night." Sterling actually laughed a short, genuine bark of amusement. "Am I passing, Major?" "You're learning, Justin," Evelyn said, using his first name for the first time. "A commander doesn't have to be the smartest person in the room. He just has to be brave enough to listen to the people who are." With a crisp nod, Major Evelyn Gallagher turned and walked out of the emergency room, leaving Dr. Justin Sterling to run his floor, not as a king, but as a captain of a very capable crew. 5 months into the 6-month probationary contract, the brutal Chicago winter had settled over Street Jude's Memorial, bringing with it a relentless stream of ice-related pileups, hypothermia cases, and slip-and-fall traumas. For Dr. Justin Sterling, The grueling season was normally a crucible of screaming matches and fired staff. This year, however, the ER ran like a synchronized, well-oiled machine. Major Evelyn Gallagher was still a phantom presence in the trauma bays. She rarely spoke during codes anymore. She simply stood in the corner, her gray eyes tracking every movement, her stylus making occasional, silent taps against her digital tablet. On the final Friday of Evelyn's contract, at exactly 11:45 p.m., the red trauma phone violently shattered the steady hum of the ER. Brenda Higgins grabbed the receiver. Her seasoned face, usually hardened to any tragedy, instantly went pale. She slammed her hand on the PA button. Code triage. Level 1. We have a pregnant female, 32 weeks, struck as a pedestrian by a sliding snowplow. Massive, blunt force trauma to the abdomen. Fetal heart rate is dropping. Maternal pressure is 50 over palp. She's coding in the rig. ETA is 2 minutes. The air in the ER instantly thickened with absolute dread. A dying mother and a dying infant simultaneously was the ultimate nightmare scenario for any trauma team. Sterling stepped out of the doctor's station. He felt the cold spike of adrenaline, the familiar terrifying pressure that used to make him lash out. But as he looked around the room, he saw the terrified faces of his nurses and his resident, Toby Miller. If he panicked now, if he reverted to the screaming tyrant, they would lose 2 lives. All right, listen to me. Sterling's voice was a low, steady anchor in the chaotic room. He didn't shout. He projected. This is a dual patient scenario. We are going to have to do a resuscitative hysterotomy, a perimortem C-section the second she hits this table, if she doesn't have a pulse. Dr. Miller, you are on the baby. The moment I deliver, you take the infant to the warmer and run the neonatal code. I do not care what is happening with the mother. You do not look at me. You focus entirely on the child. Can you do that? Toby swallowed hard, his hands trembling slightly. But he nodded. Yes, doctor. I've got the baby. Brenda, Sterling, turned to his veteran charge nurse. I need the massive transfusion protocol running on the rapid infuser before the wheels even lock. O negative. Page OBGYN and NICU stat. But assume they won't make it down in time. Evelyn stood by the doorway, her arms crossed, watching the maestro conduct his orchestra. The ambulance bay doors flew open in a flurry of freezing wind and flashing red lights. The paramedics rushed in, performing active chest compressions on a young, heavily pregnant woman named Sarah Jenkins. Her skin was a translucent, terrifying shade of blue. No pulse for 3 minutes, the paramedic shouted, breathless. PEA arrest. We pushed 1 milligram of epi. Transfer on my count, Sterling commanded. 1, 2, 3. They hoisted Sarah onto the bed. Sterling immediately stepped to her side. He didn't waste a millisecond berating the paramedics or demanding unnecessary tests. He grabbed a Hash-on-0 scalpel. Time of incision. 11:48 p.m., Sterling announced, his hand steady. He looked across the table at his team. Compressions hold. Let's get this baby out. With a single, deep, vertical slice from the umbilicus to the pubic symphysis, Sterling opened the abdomen. The trauma from the snowplow had caused a catastrophic uterine rupture. It was a sea of blood. In the past, this was the exact moment Sterling would have frozen, screamed for better suction, and blamed the nurses for the poor visibility. Instead, he relied on his hands and his team. Brenda, suction, deep in the right gutter. Toby, step up with the warm blankets. Baby is coming. Sterling reached into the blood-filled cavity, feeling for the infant. He found the shoulders, gently but firmly, extracting the tiny, motionless, blue baby boy. Cord clamped. Cut, Sterling said, slicing the umbilical cord and immediately passing the lifeless infant directly into Toby Miller's waiting arms. I've got him, Toby said, turning his back to the bloody trauma table and rushing to the neonatal warmer. Starting neonatal compressions. Brenda, I need a neotube. Focus on the mother, Sterling ordered the rest of the room. Resume chest compressions. I need to pack this uterus and find the bleeding. Where is my whole blood? Infusing now, doctor, a float nurse replied. Sarah's heart monitor remained a flat, agonizing line. Sterling was elbow deep in her abdomen, blindly trying to clamp the shredded uterine arteries. The bleeding was too heavy. He was losing her. I can't get visualization. The blood is pooling too fast. Sterling gritted his teeth, the old panic threatening to rise. Suddenly, a pair of gloved hands stepped into the sterile field. It wasn't to take over. It was to assist. Major Evelyn Gallagher grabbed a massive stack of laparotomy sponges and firmly pressed them into the left side of Sarah's abdomen, physically holding back the pooling blood and creating a clear window for Sterling's hands. Your field is clear, doctor, Evelyn said calmly, standing shoulder to shoulder with him. Clamp the left artery. I have the pressure. Sterling didn't hesitate. He saw the severed artery, clamped it, and tied it off in 2 rapid motions. Got it. Evelyn, right side. Evelyn shifted the sponges. Clear. Sterling clamped the second artery. Bleeding is controlled. Push another milligram of epinephrine. Charge the paddles to 200 joules. At the neonatal warmer across the room, Toby Miller was sweating, bagging the tiny infant with a miniature mask. Come on, buddy. Come on, Toby whispered frantically. Suddenly, a thin, reedy, beautiful cry pierced the chaotic noise of the trauma bay. The baby was breathing. Infant has a pulse. Heart rate is 140, Toby yelled, tears springing to his eyes. A cheer almost erupted in the room, but Sterling stayed locked in. Clear the mother, he shouted, grabbing the defibrillator paddles and pressing them to Sarah's chest. Shocking. Sarah's body arched violently off the table. Sterling stared at the monitor. 1 agonizing second passed, then 2. Beep, 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 beep. Normal sinus rhythm. Blood pressure began to climb. 90, over 60. She was severely injured, facing a long road of surgeries, but she was alive. Sterling stepped back from the table, his chest heaving, his scrubs soaked in sweat and blood. He looked over at Toby, who was wrapping the crying baby in a sterile thermal blanket. He looked at Brenda, who was managing the IV lines with rapid precision. Finally, he looked at Evelyn. Evelyn stripped off her bloody gloves. She didn't say a word. She simply walked over to the central desk, picked up her black, leather-bound folder, and pulled out a single sheet of paper. It was his final evaluation. She signed her name at the bottom in crisp, black ink, walked back over to Sterling, and handed it to him. You passed, doctor, Evelyn said, her voice carrying a quiet, profound respect. You led the room, you trusted your soldiers, and you won. Sterling looked down at the paper, a wave of profound relief and genuine humility washing over him. Thank you, Major. Don't thank me, Evelyn replied, turning toward the ER doors. I just pointed out the obvious. You did the heavy lifting. Keep them alive, Dr. Sterling. With a final, sharp nod, the temp nurse, who had walked into his ER and shattered his ego, pushed through the double doors and disappeared into the Chicago night, leaving behind a fundamentally changed man and a trauma bay that was finally a place of healing rather than a kingdom of fear. The transformation of Dr. Justin Sterling from a brilliant but tyrannical surgeon into a true leader stands as a stark testament to the difference between authority and command. True medical leadership is never about being the loudest voice in the room or wielding an ego like a weapon to mask internal panic. It is about the profound, quiet strength required to trust the team standing beside you. Major Evelyn Gallagher did not fix Dr. Sterling by teaching him how to cut. She fixed him by teaching him how to listen. When the terrifying chaos of the emergency room descends, a team driven by mutual respect and clear communication will always outmaneuver a room paralyzed by fear. In the end, the battlefield commander's greatest lesson wasn't about seizing control, but knowing exactly when to share it, proving that the strongest leaders are those who empower others to save lives.